Now we're going to talk about thyroidectomy. We're going to do a mini case study where you are the nurse, and now we want you to start thinking like the nurse as you start evaluating this patient. One thing you will need for this PowerPoint when we come near the end of the PowerPoint is your Android phone or your iPhone. With the phone, we have QR codes that you're going to be clicking on to make a decision as to what you're going to be doing with the patient. Before we do that, let's go through the case study here. Right now we have a patient who is presenting to the clinic, and the patient is complaining of constantly feeling nervous, losing weight, and having heart palpitations. There are other questions that you're going to need to ask the patient, but these are their main complaints. And what they are telling you is the fact that I can't seem to relax. No matter what I eat, I'm constantly losing weight and I'm not trying to. I feel like my heart is beating in my chest so hard that it's going to come out of my chest. You take the vital signs, and as you take them, you notice that the patient's a little tachypnic, but the patient is also saying that they're nervous. They're also hypertensive, but again, they're stating that they're nervous and they're in the clinic. So this could be the cause of it too. They're heading towards tachypnea, but again, this could be anxiety that's occurring. And as we talked about before, a lot of times, hyperthyroidism can be misdiagnosed as anxiety. You start asking more questions of the patients. The patient will start complaining about unable to fall asleep at night, unable to stay asleep, constantly needing to get up at night, always being hungry no matter what they eat or when they eat. They're hungry a few hours later. They're never satisfied. And they also have diarrhea at times. Now you're going to start being concerned. Start thinking about what other assessment you would perform as the nurse. What do they do before they go to bed at night? Has anything within their life changed lately? Because sometimes anxiety can be due to life changes. What's new in their life? What else is going on? What is their past history? They tell you they have no past history of anything, that they've been healthy, they usually work out, and now it just seems like they're just constantly in a state of mode where they just don't want to be around people. The patient, as you're sitting there looking at the patient and talking to them, you're sitting there and you notice something with their neck. So you're sitting there looking at them, and then you look at their eyes, and then you see the exophthalmos. And as you're doing that, you know that exophthalmos is one of the telltale signs of Graves' disease. And the main cause of Graves' disease is a goiter. Now remember that Graves' disease causes hyperthyroidism, but Graves' disease is also one of the main causes of hypothyroidism because it's an autoimmune disease. So the patient is diagnosed as having a goiter. So as the physician comes in and palpates, physician diagnoses a goiter. There you can actually see the goiter. You know what exophthalmos indicates. So what are the treatment options for this patient? So when we look at treatment, we look at the fact that they can have radiation therapy if they want. Again, radiation therapy could destroy all of the thyroid gland, and then we would have a problem, and they would go hypothyroidism. Sometimes one treatment isn't enough, and they need more than one treatment. The patient could have surgery, so we can go ahead and do surgery and remove the goiter, which usually with Graves' disease, and they feel that the goiter is starting to compromise the respiratory tract, they will go in there and do surgery. They can do PTU with hypothyroidism, but again, we need to be very cautious with patients with Graves' disease. You put them on PTU. Graves' disease, again, is autoimmune. The thyroid's going to start to destroy themselves, and then you're going to go back and have to decrease the dose of the PTU. So, because of the size of the goiter, the physician tells you that we're going to do surgery on this patient. What are the pre-op meds prior to surgery and why? So this is very important. What are you going to do for this patient prior to surgery? Okay, we know that we're going to give PTU. We give PTU to decrease the thyroid hormones, because don't forget, when they go in there and they start manipulating that goiter to get it out and the thyroid gland, what's going to start happening is they're going to start releasing more and more of the T3 and increasing their metabolism. So we want to decrease the amount of T4 that's going to start to be the precursor to T3. We're going to give SSKI or iodine or Lugo solution. The reason why we give that is for the fact that the thyroid is a very vascular gland. We need to decrease that vascularity. It will also prevent T4 from forming. Iodine is not to be used for long term, so that's why it's usually done a week or two before surgery. Remember, it takes PTU and iodine a while before they start to kick in and work. And then beta blockers. We want to control that hypertension. We want to control that tachycardia. So beta blockers are also given prior to surgery. So we have our patient. They went to surgery. They had a total thyroidectomy. Remember that after a total thyroidectomy, they're going to be started on Synthroid right away. If they had a partial thyroidectomy, they do not start them on any type of thyroid medication. What they want to do is wait, because the thyroid over time will start to kick in, and so we don't want to suppress the thyroid gland, because if we start it on medication, if we start the thyroid gland on Synthroid when there's still some of the thyroid gland remaining, we're going to suppress any action that thyroid gland may take. So the patient has just returned to your unit, and you are assessing the patient. You walk into the room. This is the first time you've seen the patient since they've been in the recovery room. As you go through the next 3 slides, we will go through them slowly. Go back and think which one of the 3 would you, as the nurse, perform the assessments on them, and in the order of priority. So think about now, what is your priority assessments with these patients? I'm going to tell you right now, airway is always a priority assessment post-thyroidectomy. So airway is not even on there because that is a given. So, and anytime we get a patient post-thyroidectomy, one of the first thing we're going to do is check the airway. Then what are we going to do? Are we going to do assessment number 1? That is, we're going to have the head of the bed elevated, make sure it's elevated. We're going to make sure the patient doesn't have a pillow there around under the neck area. We want to make sure that the patient is receiving some sort of oxygen therapy, and that we're going to take vital signs the minute the patient hits the floor. So that would be your first assessment, and that is order of priority. Then we have assessment number 2. We want to elevate the head of the bed. We want to check the dressing, and then we want to check vital signs. So is assessment number 2 what you're thinking? And then assessment number 3. We want to elevate the head of the bed. We want to check the back of the patient's neck, and we want to question the patient if numbness and tingling is occurring around the mouth. Now, as you look at this, make a decision as to which assessment you want to do, and then with your phones, you're going to take your phone, make sure you have the QR barcode scanner downloaded if you do not have it downloaded already. So if you don't have it downloaded, you probably want to stop the video and download it. Scan the barcode of the assessment choices to see if you are correct and why. And you might want to come back to the video and scan the barcode of all the assessment choices to see why they are incorrect. And what we have here is the assessment is listed to the left here, and the barcode is listed to the right. So that's assessment number 1. Here is assessment number 2 in the barcode. And here is assessment number 3 in the barcode. So again, you can scan all 3 of them, which is probably what I would suggest. Pick what you would consider your priority and scan that one first, and then you may go back to the other ones. And then think about what your further assessment will consist of. You want to do vital signs. You want to check the quality of the patient's voice. That's very important to do that. And you want to check their swallowing, because you're not going to give them anything to eat until you're sure they're swallowing and their airway's not closing off. So this will end the PowerPoint with the case study on the thyroidectomy.